My name is Kazuya Takahashi from the Division of Gastroenterology and Hepatology at the Graduate School of Medical and Dental Sciences, Niigata University, Japan. Our institution is a high-volume center for ESD for esophageal squamous cell carcinoma, ESCC. ESCC invading the muscularis mucosa, MM, and submucosa up to 200 micrometer, SM1, has a risk of metastasis. ESD is a candidate as a minimally invasive treatment for MM-SM1 ESCCs because it enables precise histopathological evaluation. This allows for additional prophylactic therapy and appropriate follow-up schedule depending on the histopathological result. At our hospital, if lymphovascular involvement is noted in the ESD specimen, additional prophylactic surgery or CRT is performed. Endoscopy and CT are performed every 6 months after ESD or additional therapy. Till date, appropriate strategy for post-ESD management has not been established. Therefore, we performed this study titled Management Decision Based on Lymphovascular Involvement Leads to Favorable Outcomes After Endoscopic Treatment of Esophageal Squamous Cell Carcinoma. The aim of this study was to investigate the long-term outcomes of ESD for MM-SM1 ESCC and to assess the post-ESD management at our hospital. This was a retrospective single-center cohort study. Overall, 102 patients with MM or SM1 ESCC who were treated with ESD were included. The median length of follow-up was 71 months. The 5-year overall survival rate was 84%. 5-year disease-specific survival and tumor-free survival was 97 and 82% respectively. The cumulative metastasis rate was 11%, and lymphovascular involvement was a significant predictor of metastasis. The outcomes of this study were favorable. In conclusion, long-term outcomes of ESD for MM-SM1 ESCCs were favorable with additional prophylactic therapy and strict adherence to follow-up. These results indicated that management decision based on lymphovascular involvement is a valid approach and that ESD is a viable therapeutic option for MM-SM1 ESCCs. I hope that this study will aid management decision-making for patients with MM-SM1 ESCC in daily practice. Thank you.